Why does pregnancy happen so easily feel so difficult for others?
Very important question. Families come to us.
Why does secondary infertility happens, ma'am?
So as I was saying that you get pregnant.
Can a woman have a high MH but a poor equality?
Very, very commonly seen.
So some questions around infertility are medical, some are emotional, and some questions are quietly, people carry for months, sometimes years. So why is pregnancy not happening even everything looks normal? When does when does waiting become delay? And is infertility only a woman's issue? Can time itself become a biggest hidden factor? So today we are speaking openly, calmly and scientifically about infertility. It's not about the fear but with the facts. To help with us, today we have with us Dr. Niharika Malhotra. She's a renowned IVF specialist, and where she is going to answer all the questions where people is afraid to often ask. So over to you, ma'am.
So first of all, thank you for having me here. So I am Dr. Niharika from Rainbow IVF Agra, and I've been practicing infertility now for more than 17 years. And I was trained in Germany, Singapore and in Bombay. So yes, we are seeing a lot of infertility right now, and as you can see, especially in India, infertility is on the rise. Now when 10 couples walk into my OPD, out of them 4 may be infertile. So there's a huge number which we are treating right now.
Okay. So let's begin with one of the most emotionally questions, which is difficult question people usually ask. Why am I not getting pregnant even when everything looks normal? This is like basic questions, ma'am. And even the scan looks fine, the cycle seems okay, and the couple appears healthy. Yet month after month, nothing happens. What are we missing?
So when we talk about infertility, we have to understand that it is not something which you can see. I am sitting here, you are sitting here, you look fine, but I cannot tell you're a murderer or not.
Yes.
Can I?
True.
So I don't know what's happening inside.
Yes.
So that's how we treat infertility. Sometimes the couple looks completely normal, but there are some hidden issues in them which does not make them pregnant. So when we talk about pregnancy, a lot of things have to be taken into picture.
Yes.
First, the age, the lifestyle, then of course their egg quality, their sperm quality, their obesity, weight management, then if the timing is happening right or not, if during intercourse ovulation happened or not, whether your endometrium was ready to implant that embryo or not. So many factors play when you get pregnant. So yes, it is frustrating, but it's now time. If you are trying for more than 2 years and nothing is happening, it's important to get yourself evaluated further.
So many couples, the problem is not that nothing is wrong. It is that the real issue has not yet been identified or addressed.
Yeah, so rightly said, when we talk about infertility, most of these couples will go to a local doctor and only 2 investigations will be done. One is your semen analysis and one is your tubal test. Nothing else is ever evaluated. And for infertility, a lot of things come into picture for getting them pregnant. Sometimes even a basic tubal test report, which is known as HSG, is wrongly interpreted. So going to the right doctor at the right time and getting the right investigations is very, very important.
So this is the question many people are beginning to ask with a real concern, that why are more young couple struggles to conceive today?
So very commonly seen, as we were talking, that infertility is on the rise. First of all, the young couples who think they are young are not young.
Yes.
They are coming to us at the age which is very later than what was happening 10 years back. So right now when a couple walks to me, most of the patients coming to us are above the age of 35. And as an infertility specialist, I always say that you should complete your family before 35. So at least minimum of 2 kids should happen.
Yes.
So first important thing is biology. Your body will grow as you age, and that is not under our control. So age is the biggest factor in infertility right now. Second important thing is what we are seeing is our lifestyle. We have seen a huge change in lifestyle in last 10 years. It is becoming very common for even women to smoke alcohol, and most of them are obese. And we all are following a very sedentary lifestyle. There is hardly any movement. And all these things play a factor in your egg quality and in males on the sperm quality. So age, lifestyle. Third is your job. Most of these couples are in a very high pressure job, so they are related and taking a lot of stress. And when you are stressed, you disturb your sleep cycle, so you disturb all your hormonal cycle, and that's also a reason why infertility is rising. So these 3 things, if we start balancing, we have to understand that there is a time for everything. Sometimes you will have to pause your career and focus on your reproductive health, complete your family and get back again.
So that's a very interesting point you have mentioned in this conversation. So this is this is not just a visibility issue. I mean, there may be also some, as you mentioned, this is a real pressure rising in a modern life, as you already mentioned in your conversation. So yes, ma'am. Another thing I just want to ask, ma'am, this is one of the most painful questions people ask in a private actually. Why does pregnancy happen so easily for some couples and feel so difficult for others?
So very, very important question. Families come to us कि my sister has gotten pregnant within 1 year of marriage, and it's 5 years and I'm not getting pregnant. Very, very common scenario, and most of us infertility specialists see this. But then we also have to understand no two bodies are same. As I can say, me and my family are very, very different. I might be susceptible to a lot of cold, cough whenever the season changes. But my brother may be more immune to it. So every body is very different. And for getting pregnant, there are a lot of factors. It's not just age. It's not just that whether you're having regular intercourse. But it is also the quality of eggs in a woman, the quality of sperms in men, and of course how your uterus was ready during that time or not. So we call it as endometrial receptivity. So these 3 parameters, which you cannot see directly, mostly play an important role in patients like these who have long-standing infertility but with basic investigations which are normal.
Yes. So in the question, I would like to ask, so comparing timeline may be emotionally natural, but medically it is misleading.
So as I always say, no two couples are same, and comparing yourself to another will actually damage more things. Instead, please focus only on your journey and how you're going to get pregnant. Let's not compare yourself to others, because then your success will also decrease.
Yes. Very well mentioned about these kind of issues. Usually people generally they compare actually with their peers, their families, so it happens, ma'am. So many are shocked when the first pregnancy happened naturally, but the second one doesn't. Why does secondary infertility happens, ma'am?
So as I was saying that you get pregnant when first time when you were only at the age of 25 or 26, and that has happened naturally. The second pregnancy you plan, now I want to focus on my career, you're focusing on your first child, so your age is also advancing. As your age advances, your oocyte quality is decreasing. That's the first common issue for secondary infertility. Second thing is, sometimes we women do not go to the doctor early, especially in mild infections. So mild vaginal infections can also go to the uterus, go to the tubes and block them. So secondary tubal blocks are very common, especially in Indian scenario. These women, if you do their tubal evaluation again after a first pregnancy, some of them will come with tubal blocks. Thirdly, our focus shifts because you become more relaxed. You don't focus towards getting pregnant. You already have one child. So you do keep delaying the treatment and you don't come to the doctor, oh, I have one child, it's not a big deal. And that casual attitude keeps delaying and then you're at loss.
So again, in the matter of same thing, like so it works once, so it should work again. It's not always medically true, as you already mentioned. Yes. So when a couple hears the word unexplained infertility, it can feel deeply unsatisfying. And is unexplained infertility truly unexplained, or does it simply means medicine has not yet found the answer?
So when we talk about anything being unexplained, the definition is that something which you cannot give explanation to. So if I don't know this, it is unexplained. That's the simple way to put it. Like, I don't know why you got cancer. It is unexplained. Similarly, for unexplained, to label a couple unexplained, there are few important investigations which have come in guidelines have to be done. Like 3 common things which we do are routine blood investigations for metabolic disorders, a semen analysis, a tubal patency. This is first line investigation, which tells us if any major issue is there or not. But unexplained infertility does not have major issues. It has minor issues which cannot be seen through naked eye. So then these couples, about 30% of them will fall into that category. They will go to the next step. For the next step, it can depend on if the woman is affected, we go for a laparoscopy. Sometimes there is mild endometriosis. Sometimes tubes are patent but they will have adhesions. Sometimes uterus looks normal, but when you put a camera, it will have adhesions or what is called as Asherman syndrome, which cannot be seen by a routine ultrasound, which cannot be diagnosed like this. So sometimes these couples get labeled as unexplained. Then, even if that is normal, the next step is to go through an IVF cycle, because then that also gives us a lot of insight. We will take out the eggs, look at them in the microscope and tell us whether the egg quality was good or not. Similarly for the sperms. Then once we do insemination, we see whether the embryo which was formed was of good quality or not. So that gives us an insight about the quality, which also we cannot see directly. So these are microscopic. So there is nothing as unexplained, but sometimes these patients have to go through a lot of investigations to, find the cause.
So as you mentioned, ma'am, like for couple hearing that terms, the message is not hopelessness. It is that the problem may be more subtle than obvious.
Yes, so that is why for these couples who come as labeled as unexplained infertility from other centers, we have to do a lot of counseling for them. And we have to make them understand maybe a good individualized timely evaluation will help us diagnose what's wrong with them, and right treatment at that time, they will definitely take a baby home.
One also as you already mentioned in your egg quality and all these things. So low AMH fear is major recurring patient public concern actually. So many panic when they hear that they are having a low AMH. So what does low AMH actually means?
So in last few months, we are seeing a lot of Instagram reels which are portraying your AMH is low, get IVF done right now. And that's not the correct way. First of all, we have to understand that a woman's fertility will depend on 3 things: her age, her AMH, her antral follicle count. It's not just single parameter, it's all 3 combined. So even if your AMH is low, but you are at a younger age, your ultrasound is showing good number of follicles, you can still easily get pregnant by simple treatment and you need not rush. Why AMH is important? Like if you are above the age of 35 but you don't want to plan pregnancy right now, then we get an AMH done just to get that hint, how long can you wait? Similarly, for young women who are not married right now, then you get an AMH done whether we would like to freeze their eggs, and if they're not getting married in the next 4 to 5 years, then AMH will give us an insight that whether we can freeze their eggs or not. But just a basic low AMH does not mean that you cannot get pregnant.
So again, like you have already mentioned that so low AMH doesn't mean like you can't conceive.
Not at all.
Not at all. So one thing also I would like to ask, ma'am, like can a woman have a high AMH but a poor egg quality?
Very, very commonly seen, and these women are usually characterized as polycystic ovarian syndrome. So what happens in polycystic ovarian syndrome? A woman has a lot of eggs in her body, more than the normal. When she has more than the normal, then these eggs do not receive the adequate hormones which the body is producing. So not all of them will be good quality. So most of these women, 50% of their eggs will be poor quality. That is why PCOS women also take longer to get pregnant. And it is very, very important here not to waste their time. What happens with us as patients also, and as also doctors also, we think, oh, she has a lot of eggs, so we can just keep trying basic treatment and she'll definitely get pregnant. And then we lose on that time which was very crucial. So if she is not getting pregnant within 6 months of your basic treatment, it's very important for her to get her eggs evaluated.
Okay. One thing also, it's very important in these days. In your experience, ma'am, what is the biggest mistake couples, makes when they're trying for pregnancy?
So the biggest mistake the couples make is internet.
Yes.
You will Google everything, you will watch Instagram reels, but you will not take out time to go to the right doctor. Get yourself evaluated and treated. So that delay which happens while you're treating your own symptoms will actually cost you a lot. Instead of Googling everything using ChatGPT, please go to a good infertility specialist and get the right guidance. Not all infertility specialists will tell you that IVF is the first option. Sometimes all you need is lifestyle change. Sometimes they'll only explain you timely intercourse. What is the right time to do what? So please get yourself tested at the right time, and that will definitely solve 70% of the infertility issue which we are having.
So the biggest mistake is not just delay. I mean, like, it is delay without direction.
Yes, correct.
So like what you are telling, it is related to like this lines actually, ma'am.